Senator Ekwe Ethuro, Speaker of the Senate, Honorable Jessica Mbalu, representing the Speaker of the National Assembly, the chairs of various committees of Parliament that are present here today, members of Parliament from both houses, the country representatives of the UN agencies present, Mr. Shidat Chatterjee, UNFPA representative in Kenya, Your Excellency Robert Godek, US Ambassador, and Excellencies, Ambassadors, and High Commissioners present here today, representatives of development partners, distinguished guests, ladies and gentlemen. The Honorable Speaker of the Senate has given ably the apology of our two cabinet secretaries, and I'll proceed to deliver the message of my cabinet secretary in this auspicious gathering. I am pleased to welcome you all to this high-level advocacy meeting on accelerating the attainment of the MDGs goals number 4 and 5 in Kenya, with focus on the 15 counties that have the highest burden of maternal health deaths. We sincerely appreciate your taking time to participate in this important discussion on maternal health, considering that women are the backbone of our society. I must say that as a ministry, we are very gratified to see many honorable members of both houses in this meeting here today. It's a show of commitment, of course, led by the Speaker of the Senate. It's a show of commitment of our political leadership to this very worthy cause. The timing of this meeting is appropriate, coming soon after our consultative meeting that we held with governors from the respective counties on the subject of maternal health. We therefore expect to build on the gains arising from that interaction with governors and consolidate the critical political support we need from both the National Assembly and the Senate towards prioritizing funding for reproductive and maternal health during the national planning and budgeting processes. Ladies and gentlemen, as has been said by my colleague, the Constitution of Kenya puts a premium recognition on the issue of high-quality reproductive health as a fundamental right for all citizens. In addition, the social pillar of the Vision 2030 envisions a just and cohesive society enjoying equitable social development in a clean and secure environment. Further, as you all know, and from the recent debasing of our national statistics or national accounts, we as a country are on course to becoming a middle-income country as envisioned by the Vision 2030. This aspiration can very easily be derailed, however, if part of the population is not participating in the development agenda. We all know, and it has been said by various speakers today, that the presence of the mother within the family is crucial to the survival and proper care of the family, considering that women in Kenya spend a bigger proportion of their income on family well-being. Reducing maternal mortality will, without doubt, therefore, have a positive impact on reducing hunger, poverty, and child mortality. Honorable members, ladies and gentlemen, the United Nations MDG 5 target sought to reduce the global maternal mortality ratio by 3/4 by the year 2015, which is now less than a year ahead of us. In Kenya, tremendous progress has been made towards this goal despite the high maternal mortality prevalence in these 15 counties that have been mentioned. And we hope they are represented here. With some of these counties, while some of these counties have reported low maternal mortality ratios estimated at below 300 deaths per 100,000 live births, other regions such as Mandera, and this has been mentioned by the Honorable Speaker, have maternal mortality ratios that exceed 2,000 deaths per 100,000 live births. Similarly, the contraceptive prevalence rate in most of these ranges from a low of 4% in some regions to a high of over 60% in others. These disparities are caused by poverty, low socioeconomic status, cultural and religious beliefs, and low uptake of high-impact health interventions. This calls for context-specific, regional tailored solutions to obstacles facing maternal and neonatal health. Other causes, other causes of these poor maternal and child health indicators relate to inadequate number of skills of health workers, insufficient equipment, an inadequate referral system, and a weak commodity management system. Lack of data on maternal health is also a major challenge that impacts on the ability to respond appropriately to address maternal mortality. In order to address the inadequacy of data on maternal health, my ministry, through the Kenya National Bureau of Statistics, has this year carried out the demographic and health survey, which will produce county-specific indicators. The report will be available to the public early next year, specifically probably by March, with data to inform the national and county leadership and partners in planning for strategic interventions. To address the human resource for health challenges, my ministry, in collaboration with the county governments, is in the process of concluding the human resource capacity assessment in the civil service. I am certain that the health sector will be a great beneficiary of this exercise. Further, as one step in ensuring that women deliver under skilled care, the government is implementing the free maternal and child care policy in government hospitals, as has been mentioned by my colleague from the Ministry of Health. It is important, however, to note that cost is not the only barrier to women attending the 4 mandatory antenatal care services and delivering under skilled care. And this really has been demonstrated by the testimony of the lady from Korogocho, that one of those is security. Majority of women do not make decisions about their reproductive health. That is another point. More often, it is the men who decide if a woman will deliver her baby in a health facility or not, as they are the custodians of household resources and hence decision makers. It is in this regard that my ministry, through the National Council for Population and Development, in collaboration with the Ministry of Health and other stakeholders, carried out a national survey on male involvement in family planning and reproductive health. The report is ready, and it will guide formulation of strategies on how men can be engaged better to support maternal health. As you are all aware, honorable members, the health function has been devolved to counties. In this era of program-based budgeting, counties are encouraged to budget for reproductive health, family planning, and child health as a program. I urge you, honorable members, and particularly the Senate, to be vigilant to ensure that these resources are allocated, once allocated, are fully utilized for better health outcomes of our mothers and children. The CDF kitty can also go a long way towards increasing access to quality health care by providing equipment and infrastructure, among other support, to ensure that our mothers get quality care. Let me conclude by once again calling upon honorable members of Parliament to play your oversight role in order to ensure that we all deliver quality and accessible services to our mothers and children. We look forward, I want to join my colleagues in also urging you and saying that we are looking forward to your personal commitment in advocating for improved maternal and child health services. We particularly hope to have your support as we seek more resources for health sector, especially in support of reproductive health, family planning, maternal and child health services. To our development partners, we acknowledge your support and your collaboration and look forward for continuation of this partnership, and to echo the rallying call of Her Excellency the First Lady of the Republic of Kenya to ensure that no woman or child dies of a preventable cause. Thank you all, and may God bless you.